Molweni, Sanbonani, and good morning. I'm Nawal, and welcome to Mamas and Papas. Today we discuss genetic diseases and stem cell research. We then look at heart problems in infants. We share some ideas for the perfect kids party. And finally, we chat about our children's milestones. As medical research develops, modern parents are faced with tough questions such as, do I save my child's stem cells when he or she is born? Pepsi, would you consider storing your child's stem cells for the future?
It's something I'm confused about. On the one hand, I didn't do it with both my girls when they were born.
Yeah.
And I hope it's a decision that I don't live to regret.
Yeah. Why you say that?
Well, because if one day they need that kind of technology, or they need to kind of get their stem cells, and that would have been able to solve whatever medical problem they have.
Yes.
Hypothetically. And I find that because I didn't store their stem cells, there's nothing I can do about it. I think that would cause any father a great amount of pain.
Yeah.
Yet on the other hand, it scares me because I don't know a lot about it, and something about it seems a little unnatural.
Well, Pepsi, we went to NetCell Laboratory to ask them what stem cell research is being done.
Stem cells are harvested from the umbilical cord of newborn babies. Once a baby is born, the cord is cut and the baby is given to the mum. The doctor or midwife will then insert a needle into the umbilical cord and drain all the blood from the umbilical cord and placenta into a blood bag. This blood bag is then transported to the laboratory. The technicians in the laboratory will then extract the stem cells from the blood contained in this blood bag. Once the stem cells have been extracted, they are frozen down to a temperature of minus 196 degrees. This is the cryogenic temperature, and they are stored like that for over 20 years. When a sperm and egg come together, they form one single cell. This cell then begins to divide to form a clump of cells, the early embryo. From these cells stem all the organs of our body: our skin, our bone, our heart, muscles, blood vessels, and nervous tissue. Scientists discovered a large concentration of stem cells within the umbilical cord of newborn babies, and advised that we keep these cells as they can help regenerate diseased tissue in our bodies in the future. The current application of stem cells is used in bone marrow transplantation. Stem cells can be injected into a patient suffering from certain cancers, blood disorders, and immune disorders to regenerate a new and better functioning bone marrow. In patients with cancer, after their chemotherapy, their bone marrow is often damaged by the chemotherapy that has killed their cancer. The stem cells are needed to regenerate the bone marrow. The patient will receive this transplant like a blood transfusion. The stem cells are taken out of cryogenic storage, thawed at the patient's bedside, and put up in a drip and injected into the patient's bloodstream. These stem cells know that they must go to the bone marrow because they are hemopoietic stem cells. They are already programmed to produce bone marrow and all the blood cells. So they know where they're going, and it's as simple as a blood transfusion. Stem cell storage should be considered in families with hereditary blood diseases like Fanconi's anemia, sickle cell anemia, thalassemia. They should be considered where a sibling has an illness that can be treated by stem cells, such as leukemias, lymphomas, and blood disorders and immune disorders. Families of African origin and mixed marriages should also consider stem cell storage, as they are severely underrepresented in bone marrow banks worldwide. It is also a question of affordability and should be viewed as a form of insurance for the family. Much research is being done internationally to use stem cells to treat diseases that perhaps drugs cannot help at this stage. Examples of that are the repair of tendons and cartilage in our joints, the repair of spinal cord tissue in spinal cord injuries, the repair of heart muscle after heart attacks, the repair of nervous tissue in cerebral palsy children. A lot of research is being done, especially at Duke University in North Carolina in the United States, on using umbilical cord blood stem cells to treat cerebral palsy children. And there have been very successful results achieved. Much research is being done in treating Alzheimer's and Parkinson's disease, and there has been some success, but the brain is a very complex organ, so a lot more work needs to be done to come up with conclusive evidence that stem cells do work. We've had a case where a little boy developed leukemia. His mum and dad had a second child, and they kept the stem cells from the second child to be used possibly to treat their older child who had leukemia. There is a 1 in 4 chance that siblings are a match, and therefore it is very valuable to keep stem cells to assist siblings with illnesses that can be treated with stem cells. There was a match between the siblings, and we still have the sister's stem cells stored waiting to be used for her brother, who is fortunately in remission.
If you have any questions or comments, SMS Mamas for moms and Papas for dads to 33126 and you can be a winner. We look forward to hearing from all our moms and pops. We'll be back after this. A parent will do anything for their children, but there are some things that not even a parent can help with. We speak to special people who give children with heart conditions a second chance at life. Good morning and welcome to our guest, Linda, the CEO of Walter Sisulu Center, and to Dr. Edwin, the cardiac surgeon.
Thank you. Also joining us this morning, we've got Viola, whose daughter, I think, got operated on about a year ago, and she's doing very well. And we've got Chris, who's on tenterhooks because his child is currently being operated on as we speak.
Yeah.
Yes. And I'm going to start my first question to Linda. Linda, what do you guys do at the Walter Sisulu Center?
The vision of the center is to actually give assistance to our indigent pediatric cardiac cases. These are children who have no access to facilities, no access or money, and we need to bring corrective cardiac surgery and make it available and accessible and affordable to them.
So, I mean, Viola, tell me something. If you hadn't been able to afford the surgery, how did you come to know about the center?
Yeah.
And how did you get to the center and find that they could help you?
Yeah, it's like my daughter got sick, and then I went to the Coronation Hospital, and then that's where I found a doctor called Hansen, who applied for my child to get operated. And then they replied, and then she qualified, and then they took it. Then they paid for an operation.
What was the problem with your child, Viola?
She was having 2 holes in her heart.
Okay. Dr. Frank, how do you guys make the decision? It's a very difficult, Viola just said her child qualified. How do you make the decision?
I probably just deal with the medical aspect, and then I'll let Linda talk about the financial
so
side.
Linda does all the hard work.
Linda does the hard work. That's right. She does the hard work.
So Linda, how do you make the decision?
With great difficulty, because obviously we have a huge number of applications and we only have limited budget. But what we do, the process is that we have a selection committee which is made up of 1 surgeon and 1 cardiologist. So we're looking at the surgical and the medical aspect of the child. And the facts are presented, and they grade the child according to how easily correctable is this procedure going to be, and that in turn relates into financials for me, because the longer the child stays in hospital, the more expensive it's going to be. And so they grade them very simply on an A being easily corrected, good prognosis, a B being slightly more difficult, or a C being very complex. And as I said, that translates into budget for me. And little Nomkeli, Viola's daughter, qualified as an A.
What are the most common heart problems for children in Africa?
Well, you can look at it in terms of heart disease that children are born with, and then heart diseases that are acquired. The ones that children are born with, basically, if you look at